What are your Medicare fraud and abuse protections? Have you ever wondered what protections are in place for you against Medicare fraud and abuse? Understanding these safeguards is essential for every Medicare beneficiary. Let's break it down together. Medicare has established several protections to help prevent and address fraud and abuse. First, it is important to know the difference between fraud and abuse. Fraud involves intentionally submitting false information to receive unauthorized benefits. Abuse, on the other hand, refers to practices that may lead to unnecessary costs or improper payments but are not necessarily fraudulent. Federal laws play a significant role in protecting you. The False Claims Act, the Anti-Kickback Statute, and the Physician Self-Referral Law, also known as the Stark Law, prohibit fraudulent and abusive conduct related to Medicare claims and services. If someone violates these laws, they can face penalties such as fines, exclusion from federal health care programs, and even criminal charges. To further protect you, Medicare has issued new Medicare cards that use unique Medicare beneficiary identifiers instead of Social Security numbers. This change helps reduce the risk of identity theft. It is important to keep your Medicare number and personal information safe. Regularly reviewing your Medicare statements is another way to help detect fraud. Compare the services and dates listed on your statements with the actual care you received. This practice can help you spot any incorrect or unauthorized charges. If you suspect fraud, Medicare has clear channels for reporting it. You can call 1-800-MEDICARE or use online reporting tools. If you are enrolled in a Medicare Advantage plan or a drug plan, you can also reach out to specialized contacts like the Investigations Medicare Drug Integrity Contractor. Medicare also has policies in place to prevent specific types of abuse. For example, there are limits on opioid prescriptions in Part D to reduce drug diversion and related fraud. In summary, your protections against Medicare fraud and abuse include legal enforcement through federal laws, beneficiary safeguards like secure identifiers, education on how to recognize and report fraud, and policies designed to prevent improper billing and service practices. These protections work together to maintain the integrity of Medicare and safeguard both beneficiaries and the program's resources.